Welcome back to the OHSU Effect. Good morning. We're going to continue talking about the partnership between OHSU and Columbia Memorial Hospital in Astoria, with what was supposed to be two doctors involved in the telemedicine program between the two hospitals. But with me now is Dr. Jennifer Needle from the OHSU Pediatric Intensive Care Unit, and Dr. Katrina McPherson from Columbia Memorial just got called away to an emergency. But Dr. Needle, we're glad that you could be here. Good morning.
Good morning. Thanks for having me.
Can you briefly describe first how telemedicine works?
Certainly. We in the Pediatric Intensive Care Unit at Doernbecher have equipment available, as well as 8 hospitals out in the community, including Columbia Memorial, for them to call us with consults, and we are able to access patient exam over video conferencing equipment. So the doctors from the community hospitals will give us a call, say, we need you to take a look at this kid, or we need to share with you some information about this kid. Do you want to take a peek at him? And the goal is twofold. One, to keep children who are healthy enough to stay within the community hospitals from being unnecessarily transferred to Doernbecher, as well as for us to provide assistance for those children who are too sick to remain where they are, and to provide additional assistance to those physicians as they manage them until our transport team can go get them and bring them to Doernbecher.
And from what I understand, it's like a robot that you're able to move from bedside to office or wherever, right?
So the community hospitals have the robot, and we just have a standing desktop computer, but they are able to move the robot around, as well as give us the opportunity to examine not only the patient. We can look at x-rays that are up on the wall. We can scan around. We can look at the monitors that monitor the patient's vital signs. We can move the robot to then speak to the patient's parents. So it really is the closest thing to being there.
And currently, telemedicine consultations are available in the stroke and pediatric intensive care units. But there's going to be a new service offered this spring?
That's correct. There is an expansion of the neonatal program through OHSU, the statewide Oregon Perinatal and Neonatal Network. And what they're planning on doing is providing real-time help in delivery room deliveries, as well as to do neonatal resuscitation simulation over video conferencing to a number of community hospitals within the state.
So how does telemedicine help a consulting physician, such as you, who is trying to assist in the care of a child that's a couple hundred miles away in an emergency room?
It really is an invaluable resource for both us and the referring physicians. We traditionally get referrals from community physicians for a patient who they either need assistance with or needs to be transferred to OHSU. There are only 38 pediatric intensive care unit beds in the entire state of Oregon. So those beds are really are a commodity. So we like to make sure that the patients that we bring to us truly need those beds. It is very unsettling for families to have to be driven or flown a decent distance from far eastern Oregon for a child who probably could be managed outside in the community. So what it allows us to do is not only get verbal reports from the physicians to get an understanding of the patient's condition, but also gives us the opportunity to see what the child looks like. And it makes such an incredible difference to be able to see a child who was described to you as lethargic, but be able to actually visualize them and understand what that physician was talking about when they describe it that way. And so we're able to interact with the physician, give recommendations about management. We're also able to then talk to the families and explain to them that their child is in the right place, staying in that community institution. They do not need to be transferred to Portland. The doctor there is going to do procedure A, B, C, and D. Or we can say to them, we agree with your assessment that the child needs to come up to Portland, and then we're able to explain that to the families. So by the time they get to us, what is an already anxiety-producing situation is slightly better because they've seen your face.
Do families and parents respond well to this interaction with this robot, essentially?
Very much. I think they appreciate knowing that there's someone else on the other end who is a specialist in pediatric critical care, who's advising the physicians on management of their child, and also reaffirming that what those physicians are doing is absolutely appropriate. And we have had many instances where once the families show up, the parents say, oh, I remember seeing you 2 hours ago. And I think it does just give a familiar face to a scary experience.
And I want to talk about a specific case where Columbia Memorial and OHSU collaborated on treating a critically ill baby. A 7-month-old girl was brought to the ER at Columbia Memorial. But Dr. Needle, you were able to assist via telemedicine from here in Portland. Tell me about that case.
Yes. Well, Dr. McPherson and one of her partners in the emergency department called me on the phone about a 7-month-old who they thought had meningococcemia, which is a very rapidly progressive infection. And I got a verbal report. The child sounded sick, but we decided that they would just send the child to us and without any additional support beyond what they had already done as far as antibiotics and fluids. And then Dr. McPherson called back and said, do you want to do a telemedicine consult so you can see what this child looks like? And in the 15 or 20 minutes from the time that I had spoken to them on the phone to the time that we connected with telemedicine, the child had become sicker. And once I visualized her and was able to see, there's a very characteristic rash associated with meningococcemia. And when I was able to visualize the severity of her rash, it was quite clear that she was getting sicker as we were talking. And so my recommendation based on that, knowing that she had to be flown to Portland, was that they put in a breathing tube or intubate her so that we could ensure that if she continued to get sicker during transport, we had a way to maintain the safety of her vital signs. And so that was done. And it was also nice because I was able to explain to her mother why that was important that we did that. And ultimately, they, because of weather, had to abort their initial flight to Portland. And so the transport for Malia from Astoria to Portland took over 4 hours. And by the time she got to us, she really was critically ill. So it turned out to be the right decision, which we were able to make based on Dr. McPherson's good judgment that we used the telemedicine and just by me being able to visualize her.
So it sounds like telemedicine is really important in treating fast-moving and sometimes lethal diseases.
Absolutely. I think because we in the pediatric intensive care unit manage some of these critical illnesses more frequently, we are sometimes able to recommend to the community docs to do A, B, C, and D. And there are times when some of those decisions are really life-saving. And this turned out to just be great decision-making on the part of the team in Astoria and ended up having a good outcome.
Dr. Jennifer Needle from the OHSU Pediatric Intensive Care Unit. Thank you.
Thank you.